Right, so tell me about Viviscal and then this machine you have there.
Right, so we did also mention in one of the earlier segments the nutraceuticals. So we've got Nutrafol, male and female, and Viviscal. Those can combine with biotin. But what you're seeing over there is the Smart Graft FUE, Follicular Unit Extraction device.
Oh, wow.
And that is the iPhone of hair transplant surgery.
So what does that do?
So this enables us to take the individual follicles from the back of the scalp for transplantation. So the day and age of the old-fashioned linear scar with stitches or staples and activity restriction for weeks at a time, that's all gone. We now do FUE, follicular unit excision or extraction is the terminology, and that's the latest and greatest tool that enables us to do it. So what this device enables us to do essentially is identify each follicle or group of follicles in the donor scalp. We're going to harvest those out, and then the graft, which is what we're taking, right? The bit of the follicle plus a little tiny bit of skin is going to go through a tubing, and it's going to end up inside the machine where it's going to be stored in a very, very habitable environment.
Okay, so obviously that's a lot more intricate than just something like this.
Yes, so a hair transplant procedure is about a 6 to 8 hour job in the office. Okay. It's going to, that's an in-office procedure done under local anesthesia. And it takes, about, like I said, 6 to 8 hours to accomplish. It takes about a week or so for the skin to recover. And then the hair growth starts in about, let's call it 6 to 12 weeks, halfway grown at 6 months, 12 months full result.